Hello and welcome to our second live event tonight. This time we are having an IVF webinar and I hope you can hear me well. So as always, please let me know that you do so I can make sure all is working properly. And Professor Luciano, can you hear me as well?
Yeah, absolutely fine. Thank you.
Perfect. Thank you so much for clarifying that. And well, again, we have another topic to tackle, and this is a very hot topic. As tonight, the Professor Luciano Nardo, who is a clinical director at Reproductive Health Group, located in the UK, he will talk about preparing for the new normal in IVF. So a very interesting topic, very hot topic for sure. And well, I'm eager to listen and find out a bit more from Dr. Luciano as well. How are you feeling tonight?
Absolutely fine. Thank you. Thanks for having me, Caroline.
Okay, thank you so much as well. And well, let me just remind everyone that we will start with the presentation. It will take approximately 25 to 30 minutes, and then the Q&A session will follow right after. So all you will need to do is just simply put your questions in the chat section, and we will publish them one by one, and Professor Luciano will be able to answer them for you. And this is another event when it comes to our Stronger Together initiative. And I just want to remind everyone that Stronger Together initiative has been brought to you with the great help of our ambassadors and partners. And well, you can see them right here, all of them. So again, huge thanks to them for helping us. And well, this is an opportunity for you to meet those top experts in the field, and I hope that for till this day you have been enjoying those webinars, and I hope that you got some answers already as well. And well, that would be it from me for now, of course. So we can go ahead with the presentation. Professor Nardo, are you ready to begin with the presentation?
Thank you very much. Thanks, Caroline. Good
Perfect.
evening, everyone. And thanks to my IVF Answers for having me once again. I think this is a very useful platform for all patients worldwide, as they can gain insight about what is changing. They can get insight about new developments in IVF, and indeed they can find some reassurance during these very much uncertain times. Tonight, I'm going to start talking about a new topic. It's a new topic as we are going to talk about new normal in IVF. It's a topic that has not been addressed as yet by my IVF Answers, and is a topic that is quite interesting, as there will be many changes affecting the field, affecting patients coming to have IVF treatment, but also is changing the way professionals work. Let me begin by saying that the new normal of work, healthcare, business, travel, and multiple industries is being written now, as the world is getting prepared to restart after the COVID-19 pandemic. And it was quite interesting, whilst I was preparing myself to write this presentation, to see what other industries have come across with, and what are the challenges or the suggestions that we plan to introduce in the field in order to move forward. If we look at what Microsoft CEO said, actually it will take some time. Remote teamwork and sales and customers and critical infrastructures will come back, but there will be a return in phases. The UPS chief financial officers said that the future consumer and business behavior will change. The Facebook CEO made a statement that the new normal means digital transformation. Citrix CEO say that the current crisis is really going to accelerate the overall trends. Erling's former CEO believes that we need a kind of safety net because customers are not going to get on board the flights if they fear of getting infected. And this is a very interesting article that was published recently in The Guardian. When COVID-19 has done with us, what will be the new normal? From online GPs, home working, smartphone tracking, the speed at which we are embracing technology is certainly unprecedented. And one of the most appreciated historian wrote in the Financial Times a few weeks ago, pandemics press the fast forward button on history. Suddenly, changes that would in the pre-corona times have generated years of debate, dissent, hesitation, opposition, and delay turn out to be possible overnight. So what is the future in IVF? This is an unprecedented time. This is a one in a lifetime for most of us, I hope. But what does the future look like in IVF clinics? Professional organizations, professional societies, such as the European Society of Human Reproduction and Embryology in Europe, the American Society for Reproductive Medicine in the United States, and two professional societies in the UK, the Association of Reproductive and Clinical Scientists and the British Fertility Society, have now produced some guidance. And it is very interesting how, irrespective of being Europe, being America, or even within the UK, there is a common knowledge that we need to stay safe. We need to practice safely and effectively to protect patients and staff. We also know from the Royal College of Obstetricians and Gynaecologists that coronavirus in pregnancy is not actually as dangerous as we would have expected. There is no, at the moment, concern that IVF and pregnancies resulting from IVF could perhaps end in an early miscarriage or a pregnancy be affected by coronavirus later on. However, we are all aware that more epidemiological studies, more information is required. The two professional bodies in the UK, in their very well written guidance, have highlighted 5 key points. 1, resumption of fertility services must take place in a manner that minimizes the chance of spread of coronavirus to patients and staff. Centers should ensure a fair and transparent approach to any prioritization policy. Resumption of treatment should not result in an undue burden on the public health system. Patients considering treatment should be fully informed about the effect of the ongoing pandemic on their treatment and give their informed consent to having fertility treatment. And finally, the fertility sector should adopt sustainable changes in working practices that help to build resilience against any future increases in the spread of coronavirus in the community. And the Human Fertilisation and Embryology Authority, which is the UK government regulator, has also produced some useful information for healthcare professionals and for patients. And there's been a huge amount of work done by many professionals in the UK, in Europe, worldwide, about trying to tackle the issues that fertility professionals and fertility patients undergoing treatment could face during these unprecedented times. The HFEA has produced guidance for healthcare professionals, for patients, has also kept records of all previous documents made available to patients and professionals. And it was very welcome, the news on the 1st of May, that fertility clinics will be able to reopen in the week commencing 11th of May. And this is based on the general directions 0014 in the UK been lifted. We, on the same day, welcomed the news on our website, and straight from the beginning of the current week, we've been working on making sure that everything we could do to make the clinic safe, to provide efficient and effective treatment to our patients could be done. And one issue that we put some thinking behind was whether patients starting fertility treatment should go into a sort of prioritization list. And our answer to this was no. There are many reasons why patients will embark on fertility treatment. But irrespective of the underlying reasons, infertility is a disease. And despite practicing for 20 years in this field, I have never come across to a patient, a couple, that wanted to have IVF treatment instead of trying to conceive naturally for fertility purposes. So it is not a choice embarking in fertility treatment. So all patient population should be treated the same when it comes to accessing fertility care. This is also more important for patient population that unfortunately embark on fertility treatment during the declining fertility stage of life. As we can see in this cartoon, with advancing chronological age, the number of follicles decreases and the number of poor quality eggs increases. So it will not be certainly appropriate for women between the age of 30 and 40 to wait to start treatment, because there might be other patients that acquire priority to begin fertility treatment. And my statement on our website, also published on the 1st of May, reads as follows. Prior to resuming routine fertility activities, we will perform adequate risk assessments, produce carefully considered written policies and procedures for risk mitigation, disseminate educational materials, and invest in new resources and systems to provide the highest quality of personalized care. And I wanted to reassure all my patients that we at the Reproductive Health Group will assist as many patients as possible to resume fertility treatment as soon as practically and safely possible. The six main, points or principles that I embrace and my colleagues at the Reproductive Health Group embrace too are safety, sustainability, acceptance, transformation, efficacy, and adaptation. And I truly believe that there is no another better time than meeting the challenges posed by COVID-19 to look at each of these principles and look at how each of them can make us better, can change our life, can change our practice, and can help us to adapt to a new life. COVID-19 will be with us for some time. I think we all need to accept it. We need to adapt to the changes. As long as they're safe and sustainable, transformation will lead to efficacy. So what have we done in the lab? What have we done in the clinic? What have we done in our waiting rooms? What have we done in our reception areas? What have we done in our staff rooms? So in line with the European Society of Human Reproduction guidance, the American Society for Reproductive Medicine guidance, and the UK professional bodies guidance, we've begun at the beginning of the week a long, hard-working journey to risk assess everything we do. Risk assessment means identifying the risks. And the questions we ask ourselves are, who might be affected by COVID-19 and how? What are the consequences of delaying fertility treatment? What actions are being taken to control the risks? And will further actions be needed? Who should carry out the actions? And then how to implement the actions? How to audit the implemented actions? And finally, how to ensure that everyone is compliant with the new actions. This is fundamental because identifying the risks now helps to mitigate the consequences. And I just want to share with you an example of one risk assessment tool we used. I'm sorry if the slide may not show clearly the subject, but we looked, for instance, at what we need to do to make our reception area safe. So we know that when patients enter the clinic, they need to be screened for temperature. And we want to be sure that our reception staff is safe, but equally, the patient entering the clinic is safe because there might be other patients that have entered the clinic the same morning or may be waiting to access the clinic at the same time. So we will embrace some changes, and the changes will be hopefully leading to a better practice, safer practice, and more importantly, a sustainable fertility practice. Once we have assessed the risks, the next step is how do we mitigate the risks? So that means what measures do we put in place to reduce the risks? This leads to significant changes in the clinic within every department. So risk mitigation entails producing policies, standard operating procedures and protocols, both for patients and staff. Risk mitigation entails physical distancing, triaging patients and triaging staff, screening, as well as testing for COVID-19. Also cleaning and sanitizing surfaces, equipment, and devices. Use personal protective equipment. Change the layout of the clinic to make patients' areas and staff areas safer. Scheduling appointments and procedures. altering the working pattern, if that means dividing the wide team into smaller teams, creating a shift system for some members of the team to work remotely from home, and for others to be flexible, as well as the clinic will have to be flexible. Changes in the way we interact with our patients, and developing a practice that has now been standard for the last 6 weeks, and that is virtual appointments using secure online platforms. Changing protocols and procedures both in the clinic as well as in the laboratory. And finally, making sure that there are educational and training resources available to patients and staff, so that all the measures put into place can be followed. In addition to general measures to mitigate the risks in the clinic, we had to go into a great deal to create some practical and logistical changes. For example, limit the number of patients and visitors in clinic at any one time. Minimize the number of in-cycle monitoring visits, if that is for ultrasound scans or for blood tests. Ensure that virtual appointments for consultations, counseling, medication stitch, pre-op questionnaires, consent taking, information events are as effective as face-to-face appointments. Embrace a strict personal protective equipment policy that both for patients and staff, depending on the clinical settings, depending on the various areas of the clinic, and as well as of being during consultations, blood tests, ultrasound scans, or theatre procedures. Limiting access to very few members of the team to clinical, theatre, and laboratory areas. Organize the delivery and collection of goods during times and from clinic sites that may not be accessed by patients, and during times when the workload is low. Have a contingency plan and reciprocal agreements with other clinics to ensure that in the unfortunate and predictable event of the clinic not being able to deliver the fertility services, patients' treatment will not be affected. Adopt a code of conduct for patients and staff. Use public notices and signs regarding safety measures, and making sure that sanitization of laboratory equipment, devices, and surfaces is conducted after each procedure and each use. Some clinical measures have also been introduced, and some policies have been created and will be followed. We endeavor to minimize the risk of developing ovarian hyperstimulation syndrome, because women that develop hyperstimulation syndrome may need to be admitted to hospitals, which means that the burden on our NHS hospitals will increase. Minimize the risk of infective complications after oocyte retrieval by using prophylactic antibiotics as and when appropriate. Offer 24 hours a day telephone support to patients and staff. Because let's remember, this is an unprecedented time that may have a significant impact on the mental health of both patients and staff. Postpone the start of treatment if patients and other partners have become symptomatic, or if tested, the results have come back as positive. Cancel treatment cycles unless in exceptional circumstances, this being for cancer patients or patients that have developed hyperstimulation syndrome, if patients or their partners become symptomatic and or are COVID-19 positive. Freeze all policy for patients and partners who have become symptomatic or they are positive after a collection. And all these changes will be implemented for the good of our community, for a better performance of IVF clinics. And we are very fortunate because I run an IVF clinic within one of the most modern and the largest standalone IVF clinics in the UK. Our facilities have not been built for COVID-19 6 years ago, but clearly they meet what COVID-19 is asking us today to meet. We have large waiting areas, we have different consulting rooms, we have large admin areas, we have dedicated phlebotomy and counseling rooms, which will all enable social distancing. In the recovery, operating theatres and laboratory areas, we are also lucky enough to have enough space to ensure that social distancing is maintained. And that social distancing is both for patients and for the staff. We have a total of 8 single rooms with ensuite facilities, which means patients do not need to leave the recovery rooms before or after procedures are carried out. We have 2 operating theatres, which will enable us to perform egg collections and embryo transfers in 2 separate procedure rooms. And we have a very large laboratory with dedicated stations, which enables the embryology team to operate, maintaining distance between them. And I would like to end my presentation with this article that was published a week ago in the Times, and is a very interesting contribution to our community. And the title is IVF will restart as coronavirus ban is lifted. And when I was reading the article, to which I contributed as an expert, I was quite taken by the title, because it doesn't say IVF will restart as coronavirus has been defeated. We have heard many times, many politicians, many authorities inviting us to defeat the virus, to fight against the virus, to eliminate the virus. But we are now learning to live with the virus. And IVF patients, IVF professionals working within IVF clinic will do their best to provide the safest environment to patients and to enable patients that suffer with infertility to have the best treatment they require now. Thank you for your attention.
Excellent. Thank you so much for your presentation. Lots of interesting information you have provided to us indeed, and some new things to remember as well. Yes, that it's going to definitely change and it will look different for sure. But good news is that it will be possible quite soon, right? Okay, perfect. Thank you. And now it is time for our Q&A session. We do have some questions ready, so let's go ahead with them, right, Dr. Nardo? Are you ready for the questions?
Absolutely, I'm absolutely fine. Yeah,
Perfect.
Sure. Let's go ahead. Keep them coming.
Exactly. Okay. Here's the first question. All right. Okay. Logistically, how to handle the situation just before embryo transfer a patient develops symptoms?
Okay, Bridget, thanks for the question. The way we will be handling in our clinic, and I think this is quite important to make it clear now. All patients undergoing treatment will be triaged at some critical points during the treatment. So, at the time of egg collection, as well as at the time of embryo transfer, or on the day, perhaps I should say, of egg collection on the day of embryo transfer, before performing the procedures, patients will be presented with a triage questionnaire. If the patient develops symptoms or has developed symptoms since the last clinic appointment, we will advise to freeze their embryos. We are still uncertain about the effect of coronavirus in pregnancy or on the pregnancy and the fetus, although initial reports are quite reassuring. But I think it's fair that we will provide the freeze-all policy in order to mitigate any potential and unknown risks.
Okay, perfect. Thank you for answering the very first question. Next one is right here as well. So what precautions can we take when attending a clinic appointment?
This very much depends on the clinic. In our clinic, we have come up with a solution to ensure that patients and staff are protected from the risk of COVID-19 infection before they attend their appointments. And what we have done, we've created some patients' PPE packs. So the patients will collect their own personal protective equipment pack, and they will be invited to wear masks, gloves when they attend the clinic. So we're not taking the chance of patients coming to the appointment not prepared, as we will be providing them with everything they need before they attend the clinic.
Okay, excellent. Thank you again for that. Okay, and so will the situation change the way person-to-person meetings are held in the clinic?
Absolutely. So, first of all, I should make absolutely clear that before patients enter our clinic, and I suspect most clinics, they will be triaged, they will be temperature screened. In our clinic, we are about to install a temperature screening pod, which is similar to a screening pod we used to see at security sites within airports. So the patient, the visitor, will step from outside into the pod and will be temperature screened by a member of our team before that person is allowed in. Once the person is within the clinic, we are fortunate because of space within our clinic, but we will be limiting the number of patients within waiting areas. And we will maintain safety, physical distance between patients and clinic staff. Both the patients and the staff will adopt a mask policy, and depending on the circumstances, the clinic staff will also be wearing face protection devices.
All right, thank you again for this information for us as well. Okay, and how about this? Are there any guidelines for patients got infected after an embryo transfer?
There are no guidelines about being infected after embryo transfer. Of course, first of all, infection has to be confirmed, and what we use in our clinic is the PCR method, which is 98% sensitive and 100% specific to confirm ongoing or past infection. We recommend that patients that conceive after an embryo transfer and they do get infected, then they will follow the national guidelines in terms of managing the pregnancy. The Royal College of Obstetricians and Gynaecologists in the UK, in the most recent guidance to patients and to professionals, doesn't say that pregnancies will be affected by coronavirus. But clearly, we are just at the very early stages of this pandemic, and we are waiting for more meaningful and perhaps robust information. But what I would say is that 81% of healthy individuals may be asymptomatic or may have only mild symptoms. So in time, there will be a large proportion of patients, pregnant women, that will become infected. And as the time goes by, we will acquire more information to provide robust advice, but also adequate guidance.
Okay, all right. Thank you again for that. Okay, perfect. Okay, and actually about those asymptomatics, as you surely know, COVID can be asymptomatic, so there is no guarantee to be infection-free, both the patient and the care provider. Anything you could add to this?
I've just made a reference to the fact that up to 81% of population could be either asymptomatic or have only mild symptoms. So it is possible that somebody will have no symptoms and will be attending the clinic. However, on the basis that we'll have no symptoms, no cough, there will be less risk of contamination, as droplets will not be disseminated. And notwithstanding that symptoms may not be present, we will still be enforcing and maintaining physical distancing and PPE requirements within clinics. So we are not lifting the requirements for PPE or screen test for those that are asymptomatic.
Okay, thank you again for clarifying that. At this point, we do not have a question, but let's wait and give a chance to everyone to type in your questions. But in the meantime, if you could tell us, I understand the clinics are reopening very, very soon. And I understand, can you tell us exactly when that's going to happen? And I understand you are already prepared for all of those safety measures as well.
We are prepared. We have prepared everything we could have possibly done. Clinics have to apply to the HFEA in the UK to reopen as from Monday, the 11th of May. The HFEA has given guidance that within 5 working days from application, they will review the self-assessment questionnaire that clinics have to complete, together with the supporting evidence to ensure that changes have been made, policies, procedures, and protocols have been produced, and then they will confirm if the center will be able to treat patients. I sincerely hope that our clinic will be one of those centers in the UK that will soon be granted the go-ahead by the government regulator in order to start providing again fertility services to our patient population.
Okay, thank you for clarifying. That's definitely interesting. So fingers crossed, yes, that all will go well. And well, it's good that you are reopening on Monday, very, very soon. And well, just we need to wait for further details as well. So someone was typing, so I just want to make sure. Yeah, there is another question for us right here. Let's have a look. So if embryos had to be frozen because a patient partner contracted COVID, is there a difference between live birth success rates from frozen versus fresh?
Okay, thank you, Madeleine. And no, the quick answer to that question is no. But actually, it's not because of the COVID-19 that we will be using a freeze-all policy. Within our clinic and many other clinics in the UK and worldwide, there's been a trend, a move towards frozen embryo transfer cycles anyway. And there is growing evidence and there is a published literature to indicate that the chances of a successful IVF cycle ending with a live birth are not significantly affected by the freezing, thawing, and transfer of blastocysts. In our own center, the live birth rate of cycles with the transfer of frozen versus fresh blastocysts is very much the same. This will certainly depend on the patient population, on the quality of the embryos, but more importantly, on the freezing and thawing expertise, policies, and procedures available within each lab. Within our laboratory, we have 98% of our cryopreserved blastocysts that survive the thawing process. So 98% of blastocysts, they survive and they're suitable for transfer.
Excellent. Thank you so much for clarifying this. We will be slowly finishing, but I do see another question up here. Okay, here it is. How did you deal with the patients that had already started the treatment before the lockdown?
Well, this is not possible, Erica. In the UK, the government regulator advised all the clinics to complete the fertility cycles by the 15th of April, which means the advice was given when the lockdown started, that around the 23rd of March. So we had a window of just about 3 weeks to complete all the treatment cycles. So there is no patient that I'm aware of at the moment in any IVF clinics in the UK that is in treatment, unless is a cancer patient, as the government has allowed the provision of fertility services for fertility preservation in cases of cancer. So before the lockdown, treatments were in place, of course, and treatment had to be completed after the lockdown by the 15th of April. If not, clinics had to cancel the treatment cycles. Now that we plan to reopen, as soon as the HFA gives permission to IVF clinics to reopen, the measures put in place, and I think the strategies that each clinic will employ should limit the risk of cycle cancellation. But inevitably, cycles may be cancelled if patients become symptomatic, test positive, or decide themselves to cancel because they may be aware of having become in contact with somebody that could potentially be infected.
All right, perfect. Thank you once again for this detailed information as well. It definitely seems that this is like new normal, and we should all get used to it for at least some time. But I guess now the most important is just so that the clinics are reopened and it's possible to go ahead with the treatments. I am sure lots of patients are waiting for that. And I'm just again waiting for someone that is typing. We will be finishing, so it is a final call for your questions. If you have any left, go ahead and type it in. I'm sure Dr. Nardo will be able to answer it. So just go ahead and do it. And let's wait.
Caroline, while we wait, let me just make a comment on a very important aspect of the new normal in IVF clinics.
Sure.
Patients that have had fertility treatment before, they know that the fertility journey is very emotional, can be quite long for some patients. And I think what's happening now with changes in fertility clinics, I do believe that some of the new policies, procedures, and protocols will provide patients with a more personalized care, because clinics will have to have more direct interaction with patients, not being face-to-face, but ensuring that different aspects of the patient treatment cycle are observed, as changes will or may happen during the treatment cycle that will compromise the patient journey. For that specific reason, what we like to do, is to provide as much support as possible to our patients, hence counseling, emotional well-being sessions, coaching, but also 24/7 support will become the new normal. Patients will no longer be treated with infertility clinics as patients attending a non-urgent medical center. Because what has happened over the last 6 weeks, patients' organizations and professional bodies have all agreed that infertility is a disease. And as such, the treatment that patients require is time sensitive, and for centers to practice safely, they need to adapt and implement new changes, actions that will allow better interaction between patient and clinic staff.
Okay, and I believe that it's actually that very positive side of it, yes, that the personalized treatment will be, you know, more taken, well taken care of. Then that's something definitely we are looking for. All right, thank you so much for adding that. And there's, in the meantime, we have one more question. So let's have a look. If a patient started to use contraception pill to regulate period before the lockdown, how long can I use these pills before I can go for the treatment?
Okay, Christina, very much depends on what protocol for controlled ovarian stimulation you will be needing for your treatment. There are some protocols where you can go straight from the pill into the stimulation, so you don't have to wait for any length of time. There are some protocols when you need to stop the contraceptive pill, but in that case, the period should return within 5 to 7 days, and that is when you can resume or perhaps start the fertility treatment.
Okay, perfect. Thank you so much once again for this. And it seems that was our last question. So, well, thank you all for joining our event tonight. I do definitely think that it was very useful for you. Well, as I mentioned, we definitely need to simply get used to it nowadays and just get prepared for it as well. Dr. Luciano, it has been a pleasure as before. It is your second webinar with us, so I'm just hoping that it's going to be possible to have another one. And thank you for so many interesting things that are. I mean, everyone is thinking about it, how it's going to be when I'm able to finally go ahead with the treatment. So huge thanks for that, for your presentation. And well, you can already see there are some comments right here as well. Is there anything at all you would like to add? Hello, can you hear me?
Yeah.
Okay, is there anything you would like to add?
No, sorry. No, I don't want to add anything. Sorry, I thought you were talking to our audience. No, I'm fine. Thank you. Thank you very much indeed, Caroline. I think thanks for having me. And I sincerely hope that this short presentation tonight has provided with some useful information to our patients and possibly some guidance. Patients that will be undergoing treatment elsewhere, so not within the reproductive health group, will know what to look for in order to ensure that they are being treated within some sort of safe and appropriate clinical environment. So exactly. I'd like to thank you again, Caroline. I'd like to thank my IVF Answers to give me the opportunity tonight to speak to our patients. And as said before, I think you're doing an amazing job as you're creating information, disseminating information, and giving reassurance during a very much uncertain time. So thank you very much.
Sure. Thank you for your kind words, for sure. And yes, we are definitely going to be here. We will definitely have more of those things for that. We definitely have more events coming up. So everyone, have a wonderful weekend. I hope you will be relaxed a bit more, and we will be back on Monday at 6 p.m. UK time and at 8 p.m. UK time. Of course, you will be able to rewatch this IVF webinar as well. You will find it very soon on our myivfanswers.com. But if you subscribe to our YouTube channel, you will be simply notified when the new video is uploaded. So go ahead and do it. Again, Dr. Luciano, thank you so much and have a wonderful weekend as well. And I hope to talk to you very soon.
Thank you very much.
Thank
Have
you
a
all.
great weekend too. Take care. Bye.
Bye.